Good morning, Neil here with the Alternate Radio Show on my series Who's Who in Santa Cruz, and today I am with the legend himself, the guru of surface air, Dr. Doug Hetzler. I'm in his house. He's got surgery in 45 minutes, so I kind of got to get this interview going. Just wonder if you have any warm-up exercises before surgery.
I think we're good.
Do you do burpees or
No.
push-ups or
No.
plank?
Keep the heart rate down.
Do you plank? Oh, you keep the heart rate down.
Yeah, keep the heart rate down.
Yeah. So you looked at my ears yesterday. How I had surgery probably 4 years ago, maybe 5 years ago.
I can't
don't remember
how. It's been a number of
I know
years.
they all rolled into one. How are my ears looking?
So you got some regrowth.
Yeah.
So I mean, it looks like there's still a decent enough channel so the water can get out and you can hear okay. But you're
I was thinking yesterday after I left. I think I think people maybe use you as a crutch because I don't want to wear earplugs because I cut the equilibrium thing.
Sure.
So I think to myself, I just go back and have the doctor, chisel me away again, and I'm out of the water for 3 weeks, and I'm back with.
Yeah, I mean that's some people's attitude, and that's fine. They can do whatever they want.
Right.
But I mean, if somebody's really trying to avoid surgery, we say, well, keep all the cold water out and try to lessen the chances. But
do you have a record holder? You have a client. I don't want the person's name. Do you have a record holder of the person that come back?
The person that I'm aware of that's had the most ear surgeries for this condition, had told me he started surfing in 1962, first ear operation 1972, and every 5 years after that.
Boom.
So that's a real outlier. That's real unusual.
And I forgot to ask you, but my question number one, which I ask everybody, your favorite Marianne's ice cream flavor is?
Anything with chocolate, caramel combined, and then
can't
have
go
to
wrong.
add a little coconut.
Can't go
Rocky
wrong.
Road. I mean, kind of a rocky road would be good.
Rocky Road. Rocky Road's good.
Yeah.
And TC's not here to defend himself,
Uh-huh.
but I mean, you've taken you've removed a lot of stuff out of TC's ears. And
Wax. Yeah.
Huh?
Yeah.
Wax.
A lot of wax.
Like the last one picture he had it looked like a Volkswagen Bug.
Some kind of bug.
Is he ripe for the surgery?
He's got a lot of bone growth. I mean,
Yeah.
it's kind of up to him to decide when it's enough of a problem if he wants to go through an operation. But
Yeah.
It's always up to the individual. I don't tell people they should or shouldn't have surgery. It's like, are you having problems? Do you want me to help you with your problems?
Yeah.
If it's not a problem, you can live with a lot of bone growth.
Right. And surface ear is what?
So surface ear is a condition where
Yeah.
bone grows in the ear canal, typically as a response to cold water stimulation. So you have a normal flat surface, and then with the cold stimulation over thousands of hours, layer upon layer upon layer of bone forms and makes these knobs that can close off the ear canal.
So the body's trying to take care of itself.
You can think of it that way. I mean,
Yeah.
it's a reactive thing to the cold water hitting this thin skin. It's the thinnest skin in the body. It's a very poor insulator.
Right.
And the effect of that over thousands of hours is that new bone grows.
Well, we're blessed to have you here in Santa Cruz, but people do come from far and wide to come see you because you have a non-evasive way of performing the surgery, correct?
Yeah.
Which is?
Well, I mean, it's down the ear canal. There's no external incisions.
Yeah.
And the key thing in this operation is protecting all that thin, delicate skin in there, and then
Yeah.
you get faster healing afterwards. So, and then my original motivation developing the technique was the issue of putting a drill in somebody's ear can generate a tremendous amount of noise and potentially damage their hearing. So
Yeah, so you don't use a drill.
don't use a drill. So they're little 1 millimeter chisels.
Yeah.
It's like working on a crystal or you're working on wood grain. So
Yeah.
tap, 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 bone comes off in plates.
So you're basically like a carpenter, almost.
Yeah.
You're like an
Sure.
ear carpenter.
Sure.
Right.
Sure.
Right?
So this is like the orthopedics of the ear.
Yeah.
Yeah.
And when did you discover or think about coming up with this new process of?
So the whole thing of, if you want the long version is I was riding my bike on Westcliff during an O'Neill Coldwater Classic.
Yeah.
Robert Scott, who has Doc's Pro Plugs, had a booth down there.
Yeah.
Stopped and talked to him in 1997. He said there was a guy in San Diego using chisels to do this operation. I called that doctor up and got a few pointers, and then we kind of evolved our own thing.
Yeah.
So 97, 98 really started doing the operation, and now 26 years later.
And Doc Scott's done a lot for surfing, huh?
Oh, no question.
Right.
I mean, he's been a very strong advocate of trying to be able to do things to not grow bone.
Yeah.
And I know he's been very supportive of the surf.
Has he had the surgery? Do you know?
I honestly don't know.
Okay. Yeah.
Not by me, but
Yeah.
with anybody else in the past.
And how many surgical procedures do you do a month? It's quite a few.
Well, I mean, I kind of think in terms of a year.
Yeah.
In a year, I'm usually treating like 110 people, which is roughly 220 ears. A lot of people have both ears done. The most I've ever done in one day is 5 ears. The most I've ever done in 1 week is 10.
Yeah.
That's a lot. That's a long time to do microsurgery.
Yeah.
But there's a lot of people out there with the problem.
And I need this to come from the horse's mouth because I did post a couple pictures of you and I yesterday, and of course, two or three people wrote it. two or three people wrote on Facebook, "Are you retiring anytime soon?"
Yeah, I'm looking old. Huh? They're going to put me out to pasture.
You, I had to tie right.
Yeah.
We
Yeah.
both looked a little.
Yeah,
Looked,
a little formal. I think I'm good for a few more years.
Okay.
I'm enjoying the work, and it's
Yeah.
very needed, and it's very gratifying work. I mean, it's very tangible. You have
Yeah.
the problem, solve the problem. So I'm good for a few more years. I don't have any deadlines in my mind yet.
Are you passing along to a younger
So
doctor
there's-
here in
yeah,
town?
I mean, yeah, there are other doctors that kind of picking up on it. I've had
Okay.
surgeons come and visit, and I definitely want to have somebody continue the process. Sure.
So if you don't want to come see the doc, buy a pair of earplugs. They're not that expensive.
Yeah.
You can spend up to from $30, probably up to the ones that Justin makes at Listening Stack, which
Custom, sure.
I think the custom ones are a couple $100, but cover your ears, and you don't have to come see this guy, even though he's great. So thanks, doctor, for the time this morning.
Sure.
I appreciate it.
Good to see you.
Got more socks. If I see you at Marianne's, I know what to buy you. Yeah, put those up. Every guest in Santa Cruz, every guest on the Off the Radio Show gets a pair of Merch 4 socks, so he gets a pair.
Very artistic.
Very nice, huh? Thanks,
Kaya
doctor.
Mayal. Okay.